Hi, I'm John Connolly, Clinical Director at Bevan Healthcare. I'm a GP. Our team at Bevan Healthcare provide GP services, nurses and doctors and associated teams to people who are vulnerable in the cities of Leeds and Bradford. Our clients are sometimes vulnerable migrants. They may be people who are experiencing homelessness. Some of them are sex workers, some of them are refugees. And they have quite specific needs which are somewhat different to the general population. We sometimes describe them as having trimorbidity, which means that they not only have physical health problems, but they very often have mental health problems complicating those physical health problems. And many of them also have drug dependency and alcohol-related problems. When our patients were first affected by the pandemic, the COVID-19 pandemic in the spring of 2020, we very soon realised that there were a sector of the community who were going to be particularly badly affected. We were all told that we had to stay at home. Well, how does that work if you haven't got a home to stay in? We were told that we'd have to socially distance. How does that work if you are living in a hostel? And new arrangements were needed for the supply of things as simple as food, as simple as alcohol and methadone for patients who are dependent on opiates. The other aspect that was very apparent to us early in the pandemic is that our patients not only are socially excluded, but they're digitally excluded. All of us had to start using digital methods for many aspects of our lives, including healthcare. So formerly, our patients would be able to knock on the door and turn up to drop in services, but we had effectively locked the door and asked them to use the phone or to use the electronic forms, web forms and Skype type consultations, so that they weren't attending face to face to see the nurse or the doctor. This was especially difficult for our patients, and we needed to work out how we could help them through this difficult time. So at first, we thought we started to give out phones, sometimes very basic phones, and we started to point our patients, give them advice about how to use digital methods of consultation. And we realised quite quickly that that wasn't working very well, because it wasn't just the technology that they were lacking, they were also lacking the skills and the confidence to use technology to get the care and the services that they need. That led us to then collaborate with our other fantastic partners in this project, who are Groundswell, who have great experience of recruiting and training peer advocates, and 100% Digital Leeds, who are the local experts in digital inclusion, as well as colleagues from Helm, who have a patient-held electronic health record. So over the last 18 months, we've made great progress in recruiting and training our peer advocates. We call the project Smart Health Inclusion Peer Advocates. They are volunteers with lived experience that's relevant to our client group, and we train them to be smart, to use smart devices and to help our end users access digital platforms and apps and the sort of web resources that many people use routinely, but from which our patients are sometimes quite excluded. I was fortunate a couple of weeks ago to go to one of our clinics where in the upstairs training room we had a team of newly recruited volunteers who had come for training, specific training about being a peer advocate and training about the digital aspects of this project. And I was completely wowed by the people in the room, both the trainer and the delegates who'd come for training. They had come from the asylum seeker community, and others were people who had experienced homelessness in their lives themselves. But each of them came with an open mind and a willing spirit to volunteer and to learn and work out how they could help us with this project. And what was very obvious was that they all had really relevant skills and experience. So having recruited and trained 2 cohorts, one in each city, of our peer advocates for this programme, we're now ready to start deploying them to work with end users, and we're finding opportunities where they can really be helpful with a particular focus on digital exclusion. We plan to evaluate the scheme as it goes, gathering up the experience of the volunteers themselves, but also the benefits for our end users. I sometimes say that this is the project that keeps on giving. Of all the projects that I've worked on in nearly 30 years as a GP, it's the one that seems to have most potential to really make a difference in our patients' lives.